What mental health issues are linked to cannabis use disorder? Imagine a puzzle where pieces fit together in unexpected ways. Some of those pieces are mental health issues that can connect to cannabis use disorder. When people use cannabis heavily or regularly, it can influence their mental health in several ways. One major concern is psychotic disorders. Using cannabis often, especially high-potency types or starting young, can increase the chance of developing symptoms like hallucinations, paranoia, or disorganized thinking. For some, it can trigger or worsen conditions like schizophrenia, especially if there is a family history or early use. The risk of psychosis tends to be higher in those who use cannabis daily or in large amounts. Anxiety is another issue linked to cannabis use disorder. While some folks use cannabis to feel calmer, long-term or frequent use can actually make anxiety worse. It can lead to social anxiety or general feelings of worry that stick around. Depression is also common among heavy cannabis users. Over time, using cannabis daily can interfere with the brain's dopamine system, which helps regulate feelings of pleasure and motivation. This can cause feelings of fatigue, sadness, and a lack of interest in activities once enjoyed. Instead of helping with depression, cannabis might make it more severe or persistent. Suicidal thoughts and behaviors are more frequently reported by those who use cannabis heavily. The connection is concerning because it shows how cannabis use disorder can impact mental well-being deeply. For people with bipolar disorder, near-daily cannabis use might make mood swings worse, leading to more instability. Many times, cannabis use disorder and other mental health issues happen together. This is called co-occurrence. Sometimes mental health problems lead to cannabis use, and other times, cannabis use can make mental health symptoms worse. Changes in brain chemistry involving neurotransmitters like dopamine are common in both conditions. From a treatment perspective, screening for mental health issues is very important when someone has cannabis use disorder. If a person has a history of psychosis or severe mental illness, avoiding cannabis altogether is usually recommended. Addressing both the substance use and mental health at the same time can lead to better outcomes. Stopping or reducing cannabis use often helps improve anxiety and depression symptoms over time. In short, cannabis use disorder is most strongly linked to psychotic disorders like schizophrenia, but it also relates to anxiety, depression, mood instability in bipolar disorder, and increased suicidal thoughts. The risks are higher with frequent, heavy, or early use, especially in vulnerable groups. Recognizing and treating both issues together is key to helping people stay healthier mentally and physically.